Hand, foot and mouth disease is a virus infection. It's usually caught by kids, although their parents can catch it if they didn't have it themselves when they were younger. The bad news for the children is that with a lot of conditions, like say glandular fever, if you get it when you're young, you get it quite mildly. And if you get it when you're older, it's much worse. This is the other way round. Kids under 10 tend to be much less badly affected than the very young ones in that age group, kids under 5. And adults tend to have least problems of all. Because it's really infectious, and because you're infectious from before you develop the blisters that make hand, foot and mouth so easy to pick out, then actually this can spread like wildfire. It'll spread through whole nurseries, through whole schools. About a week after your child comes into contact with someone who's infected, even though they may not know they're infected themselves at that time, they'll often come down first of all with a cold, feeling a bit miserable, feeling a bit fluey, the way kids do so often. What will often happen then is a couple of days later they develop blisters, or first red sore patches in the mouth, can be on the tongue, can be right over the roof of the mouth, and it can be inside underneath here. Those will gradually turn into blisters, and those blisters will wear away, leaving ulcers underneath. About 3/4 of kids who have hand, foot and mouth also develop, funnily enough, blisters on their hands and their feet. But actually it's not called hand, foot, mouth, buttocks and genitals disease, even though they can occasionally get blisters in those areas as well. These blisters tend to start off as red patches, and they may be kind of quite greyish. When the blisters come off, again, you'll be left with sore ulcers. The good news is the vast majority of kids get over this with absolutely no problem within a week or so. And the nursery won't, for instance, make you keep them off until every single lesion has completely healed over. However, they will almost certainly say that you need to keep your child off school or nursery for about a week until they're back to normal and until all those blisters have stopped forming. What you need to do for your child is basically keep them happy as much as possible and keep them out of pain. Really important, especially in young children, because they've got blisters inside their mouths, drinking can be a real issue. So you may need to coax them to drink as much as possible. Children, especially children under 2, and especially very small children under 1, are much more prone to dehydration because they don't need to lose as much fluid to get dehydrated. So for instance, if your little one is not peeing regularly and therefore they've got dry nappies for long periods, if their skin looks very tired when you pull it, it looks like an old lady's skin, if their eyes are sunken, if they're really listless and you can't rouse them, you do need to see your GP. Other than that, complications are really rare. Do think about using regular painkillers. The blisters on the hands and feet are miserable, but the ones in the mouth can be really sore. If they aren't doing the trick, perhaps talk to your GP about a spray or a gel that will help to make it easier for them to eat and make it less uncomfortable. If by any chance they become extremely unwell, especially if they develop fits, anything like that, of course, if they have a seizure, you take them straight to hospital. But most of them, don't worry.